I reckon I've seen the sickest guy I have in my entire career. Have a listen to what I've seen. Hey, what's up, guys? It's Confessions of a Doctorholic with Dr. Slayman. I've seen the scariest patient I've seen in my entire life. I received a page one night, and it basically says that the patient is being transferred from another hospital for a perforation. So I head downstairs to the emergency department. There are a few things that are like emergencies. One of them being, and like honestly the main one, is someone that's hemodynamically unstable. So like basically blood pressure in their boots, so like really low, they're tachycardic, like clearly there's something going on that's like really wrong. Anyway, I'm like really concerned at the moment because this would be something that can make someone unstable very quickly. I run to the emergency department and I'm in this room. And this guy looks scary as, like, to be honest with you, I had to take a deep breath to just like collect my thoughts and go in a systematic order. He looked sick as shit. And what I mean by that is that he's laying down, he can barely speak, he's just breathing heavily, and he's just like, I'm in pain. He can barely speak. He's breathing super heavily, and he looks grey. For lack of a better term, he just looks grey, and he just doesn't look like, there are different kinds of patients. There's obviously people like you and I that are listening to the podcast that are completely fine, and you're sitting down and like there's nothing that's like hurting. And then there are people that have like mild pain and they can sort of talk to you about it. You can collect a proper history and you're not as concerned about them, and like they're stable in every other way. This guy, he looked bad. Just subjectively, if you're walking down the street and you saw this guy, you're like, oh my God, like something's really wrong with this patient. I could barely understand anything he was saying. He could barely speak. Thank Christ his wife was over there. So I just asked her, I'm like, okay, so like what happened? Have you had any surgeries recently? And I'm just basically trying to figure out like what in this guy's history is screaming at me and like indicating a cause. I'm thinking like, does he have a diverticulitis? Does he have like Crohn's disease or something like that that would cause him to have like a massive colon and a perforation? And just before he got here, the previous hospital did a CT scan on him. So you can see air everywhere. So I'm already like super concerned. So the wife tells me that he had back surgery 2 weeks ago and he's just never been okay afterwards. Like he's never been like, it's supposed to make him feel heaps better, but ever since he's been home, like there's just like more and more pain and he's just deteriorating. And like 2.5 weeks later, he's back in the hospital. Anyway, I go to do the physical exam and like literally like textbook picture of an acute abdomen. I'm there and he's got pain everywhere. He's literally like jumping from the pain. I can barely touch this guy and it's just all over the place. And I'm touching him and suddenly all of his muscles are like clenching. He's so rigid. So obviously I call the seniors because they don't trust me yet. I just started my training. They don't know if I know what I'm looking at and if I'm making the right calls. And to save everyone time, I was like, okay, let me just get consent. I know this guy's going to have to go into surgery. I just don't know when. So that's literally what happened. I run up to the senior. I try to do my best job at like telling him like age of the patient, this is what happened, this is his previous history and the surgeries that he's undertaken, and he has massive air in his abdomen. And yeah, senior comes back. He says the magic words to me. I agree with your examination and assessment. And I'm like, yes, winning. Alrighty guys, so that was at the end of my shift. Come back. This guy had an exploratory laparotomy, which basically means they opened him up. They found out where the perforation is. It was in the duodenum and he ended up in surgical ICU, so SICU. I have been following this guy for 3 weeks and he's been through so much. He's had some infections. He's had some stuff going on with him. And it honestly broke my heart. But finally, in my final week on this placement, he has been getting better. I've seen him on PT and OT appointments, and like they're like just like walking around the wards. They're making him move a little bit more, and it's made me feel so happy because this guy is definitely getting better. Just like objectively, like sitting on the chair, smiling, talking to us again. And this is like one of those moments where I'm like, oh my God, like I'm so glad I'm in this field. I just love seeing that. I just love seeing that change, and the fact that he's like definitely turning around. I finally discharged him yesterday, and honestly, like, it's brought me so much joy. I'm not gonna lie to you. I'm so glad.